Okay, so here we're just going to talk about the elbow. So the elbow here is a synovial hinge joint, meaning that there's a membrane that allows it to glide and slide synovium. So basically what happens here is we have a trochlear groove, and then we have a concave aspect onto the ulna, convex onto the humerus, and then what happens is it glides and slides onto what we call the medial radial ulnar joint here, or the lateral radial ulnar joint here. What happens as well is we have the radius, which radiates into a pronated position, and it then radiates into a supinated position. It has a slight concavity to the radial head, so when it rotates over the ulnar shaft, it's able to glide over without touching in that aspect. We also have down on the outside, we've got the lateral condyle of the humerus and the medial condyle of the humerus, and then we also have on the posterior aspect your olecranon process. So if we were to apply a stress from in this position, so applied a stress to open up this joint on what we call the ulnar collateral ligament, then we'd apply a valgus stress, and then if we do the opposite here, we apply a valgum stress because it compacts on this side and opens on this side. So this is the lateral collateral ligament that's being tested in that aspect. Okay, so then we also have your medial tennis elbow, which attaches onto your medial epicondyle here, and then we also have your lateral for your tennis elbow. So yeah, I don't know if I said that, but we have medial for the golfers, lateral for the tennis. Then we also have on the posterior aspect where the tricep tendon attaches onto the olecranon process, you can have inflammation there onto your tricep tendon too. So if we were to go back down the shaft now from the proximal radial ulnar joint, and then we travel down, we also have the styloid process. So we've got the medial styloid process, the lateral styloid process, so of the forearm. And then now if we were to pronate into this position, I'm just going to show you, I'm not sure if you can see here, so the basic bones that make up the wrist, so there's 8 of them. So we have the scaphoid, then we have, so the scaphoid, the lunate, the triquetrum, and the pisiform. So these are the ones that make up the bottom part of the wrist, so closest to your radius and your ulna. And then we also have the trapezium, the capitate, and then the hamate, which make up the top of the wrist. If we were to continue on down from that, we also have your digits. So if we were to go from this one here, we have your 5th, 4th, 3rd, 2nd, and 1st digit. We have your proximal interphalangeal joints as well, so, and we have distal. So in this case we have proximal here and distal here. And then if we were to go back, I just want to, maybe I'll show you from this aspect here. So what we have on here is we have the hook of hamate. So I don't know if you can see that, but it's a relative hook shape, and that's when you apply pressure onto your hand there. You may feel it into your pisiform, which is on the outside of your hand, or you may feel it on the hook of hamate as well. So I hope this short video helped, just giving you a little understanding on the elbow.